We're now going to embark on that conversation on the role of research in finding answers to the ravaging problem of COVID-19 in Nigeria. How can the research community help out? What is happening to research grants being approved for Nigerian universities? And other issues, of course. And for all of that, we're now being joined by Professor Suleiman Bogoro, Executive Secretary, Tertiary Education Trust Fund. Professor Bogoro, welcome to the program.
Good morning, Professor.
Thank you for joining us. Hello, Prof. Good to see you again. Good to see you again after such a long time.
Thank you, my dear. Thank you, Doc.
Yes, welcome to the morning show. Well, before we begin to talk about research and TETFUND and COVID-19, first of all, I would like you to tell us a few things about the Tertiary Education Trust Fund. I mean, it's supposed to be an intervention fund to support the university system. And yet, in spite of that, we have university teachers, polytechnics, colleges of education, always going on strike, always protesting that government is not providing enough support. And in 2017, the Buhari government provided enormous support. In 2018, President Buhari again approved about 161 billion naira for disbursement to universities to support research, to support scholarship, to fill the gap, whatever funding gap exists. Now, where does the problem lie? Is it that these universities, colleges of education, and polytechnics are not following the guidelines for accessing TETFUND? Or is it, as many people argue, that TETFUND is very partial and that TETFUND is politicized? Let's clear the air on this before we begin to talk about how TETFUND can support the universities to do research in relation to COVID-19. Prof, I see you are smiling. Prof?
Yep.
Yes.
Well, I could go on and respond to, I know you put up quite a number of questions about the same time. Let me proceed to respond to the very first part, and that is what I will consider the mandate of TETFUND in context of the TETFUND Act of 2011. For those who may not know, let me take us a little bit years behind. The emergence of ETF that eventually transformed to TETFUND in 2011. ETF emerged consequent to negotiation between Academic Staff Union of Universities, ASU, in the early 90s, precisely between 1990 and 92. And with an agreement signed in 1992 between ASU and the federal government, then military President Babangida, eventually coming into law in 1993 as Education Tax Fund and subsequently Education Trust Fund by 1998. And somehow between 1993 and 2010, the funds were applied. In fact, the application of the funds actually started in the year 1999, 2000, when then Led Olakunri was made the chairman of the Board of Trustees. And very sadly, as it were, the funds were applied across the board. In other words, it is recalled that the original concept was for universities, polytechnics, and colleges of education owned by federal or state governments to benefit. But somehow along the line, even the basic subsector benefited, as well as, in fact, many institutions outside the education sector, including, as it were, nursing schools, colleges of agric, as well as the law school. And that made the impact very minimal. And that is why it was reviewed. And the focus was rejected. And in 2011, at that time, TETFUND, led by the current INEC chairman, Professor Mahmoud Yakubu, refocused. And the refocus was for the tertiary subsector exclusively. And as I indicated later, actually, not only universities. In fact, during the negotiation, although it was ASU that negotiated, but they felt, let us be fair to the other tertiary subsector institutions, that is the polytechnics and colleges of education. And it was agreed, and it reflected in the laws that emerged subsequently, that, well, the university should take 50% of the funds, and the remaining 50% be equally split between public polytechnics and colleges of education. But like I said, because many entities outside the education sector benefited, the impact was considered inadequate. And that is why from 2011, when the name and the focus was changed, and the mandate now was very clear, only federal and state universities, polytechnics, and colleges of education were to benefit. It is very obvious that there was wisdom in that decision. And that is why it's become more manifest, the impact of TETFUND as it was originally conceived from that time. Because at the time when ETF actually was negotiated and it came into being in 1993, I still recall that ASU had said Nigerian universities had become glorified secondary schools. And essentially because of inadequate physical infrastructure, and if they existed, they were largely decrepit, in very sorry state. But thankfully, from that time when ETF came into being, and particularly from 2011 to this year now, we're talking of 9 years, there has been manifest impact. I must say this, whatever criteria somebody wants to use. Yes, Dr. Abati talked about, well, TETFUND might have been politicized. But let me say this, it depends on somebody's interpretation. After all, TETFUND is a product of political creation. So it depends on what somebody means, because the law of TETFUND is very clear, and it indicates very clearly, as it were, that the application of the funds through the various interventions, we have about 15 intervention lines, which I guess I hope I find time to speak about them later. There has to be equity, essentially between the 6 geopolitical zones. And so there is political sensitivity, let me say this. And for me at TETFUND, I go around this country, I commission projects, and I can name across Nigeria from the extreme north to the extreme south, extreme east to the extreme west, institutions that have benefited, so much so that it is said that if you go to these public tertiary institutions, the University, Polytechnic, and College of Education, that some of them could as well be renamed TETFUND institutions. I think in that respect, sitting from my office, I feel good that there is wisdom in the emergence of an intervention agency that today handles over 90% perhaps of the fiscal infrastructure requirements, but even more importantly, what we call the content component, leading us to the issue, the question that I guess we'll spend most of the time later speaking about, and that is those key content components of all of them. Research is virtually #1. And conference attendance, of course, manuscript development, transforming PhD thesis into textbooks, and so on and so forth, journal support for both professional journals initially and as well as institution-based journals, we hope. And so increasingly, there has been added and sustained presence of TETFUND, and there is no doubt about it that TETFUND, in fact, let me say this, today in Africa, more than 6 countries have come to ask from TETFUND, what is the secret? And even in Nigeria, we are proud to say this, that we have attempted to justify, and Nigerians generally appreciate what we've been doing. That is not to say we may be perfect. We take criticisms, and that is why recently we undertook and are about to receive a report on impact assessment of TETFUND. We decided to self-assess ourselves, which is pretty rare in the public service. And we are hoping the report will come, and we picked non-TETFUND staff, independent consultants and experts to undertake that impact assessment because we have nothing to hide. And we submit ourselves to suggestions and criticisms where we need to improve.
Professor Bogoro, thank you. You have explained yourself with regards to TETFUND and the role that you played, especially over the past 9 years in terms of developments. Now, I'd like us to take all of that context and apply it to today's pandemic. There's a global race for a vaccine. Research and development is at an all-time high. And one would like to know and really find out the capability or possibility of our tertiary institutions here in Nigeria, particularly our universities, coming out or being able to produce, let's say, a vaccine or some sort of solution to COVID-19.
Thank you very much for that question. I knew we were coming to that. For vaccine production, it is the ultimate, as far as I'm concerned. In the science community, speaking about my area, my discipline, I'm a biological scientist, and I should appreciate better the threat of infectious diseases. That is what COVID is. But as we know in Nigeria, we have other infectious disease threats. Of course, we have the Lassa. And it's been said that in this country, so far, more people have died from Lassa fever this year than COVID. Of course, the rate at which COVID is going, it is very likely that the number will continue to rise. We hope not, though. With the concerted effort by the Presidential Task Force, the experts, Nigerians, and indeed, it's a pandemic anyway, so it's a global challenge. Yes, production of vaccine, let me say this, that it's more demanding aspect of the intervention to contain the pandemic. That the vaccine is the very thing I call the ultimate. There are a number of palliative initiatives, I so call them, and that is production of PPEs, production of ventilators, and so on and so forth, as well as any, what I would call trial attempts to contend for those that have been found positive with COVID. The scientists are not resting. Let me say this, that so far we've tried to convey our position in respect of the fact that we have experts in Nigeria in the research community. And let me also add that when we say research community, well, it's always been said that traditionally universities are the leaders of research, but that the university do not operate in isolation. They need, for instance, the research institutes in the various disciplines. They need centers of excellence that exist in this country. And for us in TETFUND, although we're dealing with public universities, but that we have private universities. And there's no doubt about it that I am aware, for instance, that the Redeemers University has gone far in its exploits towards gene sequencing in order to arrive at conclusive vaccine that addresses a number of infectious diseases, including COVID. And many of our public universities, both federal and state universities, I have privileged information because we are communicating with the National Universities Commission and other entities that are associated with research in our tertiary institutions. Let me say this, that our researchers are eagerly waiting to be engaged. And for us, working closely with the National Universities Commission, TETFUND, we know of the efforts that are ongoing, including prototype production of ventilators by a number of universities. We know that, however, that for vaccine, it takes a little longer, a longer protocol of certification. It's not just the laboratory production of a vaccine, but that the clinical testing and trials takes quite some months. And that is why listening to Dr. Fauci in the United States and many other experts, including many in this country, Human Virology Institute, etc., it is obvious that we have to be a little bit patient, perhaps quite some months from now, where in April, some of the experts have said it may not be earlier than August, perhaps, before a certified vaccine could be applied. I am quoting the experts because that is not my area of expertise.
Well, Prof.
But let's hope that that eventually happens. But
Prof.
take it from me. We are in liaison, we have received intentions and initiatives already on some of these things, including vaccine production. It is recalled that one of the testing sites in Nigeria is the National Veterinary Research Institute, VOM. And let's note, many of the infectious diseases are zoonotic. And to be zoonotic, that is that some of them are transmissible between humans and animals.
Prof.
And so the scientists, both the human medical doctor as the veterinarians, etc., and the molecular scientists are working in concert. And we are in touch with the NCDC.
Well, Professor Bogoro, if I may interrupt you here.
That, some initiatives will be done, and you will get to hear about it very soon.
Yeah, if I may interrupt you, I mean, it's good to hear that you are working together with the NUC and that you are in touch with some other organizations making efforts to get a vaccine and be part of the research for a solution to COVID-19. But how about TETFUND? To what extent is TETFUND itself ready to support that research? Do you have the resources, or do you need help, maybe from the private sector or from the central bank or directly from the federal government, to be able to intervene and support the research process in Nigeria?
Thank you very much, Dr. Abati. I can proceed to say very clearly that, yes, today in the research community, I'm almost sure that the TETFUND research grant managed under the National Research Fund, NRF for short, and currently chaired by Professor Bamiro, is the largest single visible research grant in the Nigerian tertiary education system. And it is recalled that only last year, the Board of Trustees of TETFUND, on the initiative and advice by management, recommended through the Honorable Minister of Education, Malam Adamu Adamu, to Mr. President, an increase from the original seed money of 3 billion to 5 billion. And Mr. President approved it. We are even hoping that in the 2020 budget, that could still be scaled up. In other words, it reflects what I personally did as soon as I returned to TETFUND, when Mr. President graciously reinstated me January last year to my office, as it were, in TETFUND as the Executive Secretary. I made it very clear in consultation with stakeholders associated with our mandate that we must proceed to emphasize the correct thing. Let me say this. Globally, the global rating and ranking of universities is much less because of ordinary fiscal infrastructure. It has significantly to do with the quality of research and, of course, faculty. It's quality of faculty that reflects the quality of research. And, of course, faculty members cannot do research if there are no equipment. So, yes, addressing the issue you raised, to what extent is the support that TETFUND is expecting from government and beyond? Today, there is no doubt about it. The message is very clear. While we're all in lockdown across the world, that more funding is actually required. And that is why, from TETFUND, we try to increase the amount for research to apply, especially for applied research. That is the National Research Fund that has a grant level of up to 50 million. And I want to say this, that there have been, in fact, including among the 128 research grants that were signed in January this year, there are 1 or 2 that worked on infectious diseases, as it were, and we are hoping that it can be scaled up. And beyond that, as I talk to you, we have had communication from many vice chancellors, colleges of medicine, teaching hospitals, experts, virology experts. You've listened to a number of the experts, professors, and deep researchers, as it were, in this country, communicating in the various media. It is very clear, and the Presidential Task Force, the PTF, is very, very focused in terms of ensuring that there is increased testing. And if there is increased testing, it is those experts that are involved. That is increasing even the sites for testing. But profoundly, and we know that with the initiatives in these research centers and with the support of federal government, as it were, we are expecting that there will be a window, of course, to support the research that we have been doing. But beyond that, let me also add that the TETFUND, in the 2020 budget, there is a proposal. In other words, there is a proposal for supporting the emergence of, or support rather, for colleges of medicine in terms of simulation equipment in medicine. That is one angle. Of the 12 centers of excellence, TETFUND centers of excellence that are likely to emerge soon, about 3/4 are in the science disciplines, and a number of them are in medicine and pharmaceutical research. And so we are very conscious, and we are determined to work with NCDC, the Federal Ministry of Health. In fact, we wrote a letter to the Honorable Minister, and if not for COVID, we were supposed to have had a meeting with the Honorable Minister of Health to share perspectives about partnership in the area of research that at the moment we're holding about the largest grant for tertiary institutions in this country. And we went beyond that, recognizing the fact that private universities and private research institutes, as well as the industry, are all involved in research. We invited the industry, as well as private research institutes, as well as private universities, to partner with the public universities as partners, as it were, officially in the research grants. And a number of the grants that were approved includes the partnership of those private entities or others that may ordinarily be called non-state actors by the World Bank and other research grants across the world.
Thank you, Professor Bogoro. I'd like to come in here. You said that the quality of our faculties affects the quality of research, and now we're speaking about research grants coming in. Now, if we look at the global race once again for a vaccine and a solution, how much of a contribution is Nigeria in a position to actually make to this global race? How much research can we put towards this, etc.?
Thank you very much. I would rather respond from this perspective. Take it or leave it. It's a fact that Nigerians are in some of the best centers of excellence across the world. And best centers of excellence include the NASAs of this world, including the universities that are the, as we call them, the topmost of the Ivy Leagues. Universities. Nigerians are operating there. It is our desire that, especially now, with the closing of borders, virtually every other nation is closing its borders. Well, as we close our borders, definitely I've been following the Presidential Task Force, and I also watched the CBN governor reeling out a stimulus package. And there is a component to support research, and understandably, as it were. So since we have experts across the world, some of them, there were many reasons. In the past, we talked about Brendan that met a number of, that reflected a number of some of our best leaving the country, going not only in the field of medicine, but other areas. But that we are confident that as the environment for research gets improved within the country, those experts will return. I mean, for instance, the Director General of NCDC returned from diaspora, I understand. I've not come close to him, but you will agree with me that this man is doing a great job. For Mr. President to mention him in national address, the role he's playing, of course, as well as the entire PTF, as it were, in the fight against COVID, is to recognize that people are distinguishing themselves. I can assure you that I am privileged also to know. Only recently we did something from TETFUND. We undertook some capacity building for research grant access skills development in Dubai, in Dayton, Ohio, and in Cambridge. It was to give us opportunity for cooperation and peer review. And many of the professors, some of the best that we have in this country, were very happy that we did that, because there is no country in the world that operates in isolation. If you look at the sustainable goals, there is emphasis on cooperation.
Well, Prof, on that note about cooperation, we need to bring this to an end, and we've been having a very exciting conversation with you. We would have wished that it went on for maybe another hour. But thank you very much, Prof.